Hello, and welcome to Week 2 for Coding, Chapter 3 and 4, ICD-10. This is being re-recorded because the VCR did not work when we had the live class. So this will not be a 3-hour lecture. Instead, it will go over the highlights of the chapters and how to use your ICD-10 book. My name is Doreen Bovin, and I am your coding instructor. Let's turn to page 49 in your step-by-step book. It is the chapter on ICD-10 Outpatient Coding and Reporting Guidelines. And I want you to also turn to page 70 in your ICD-10 book. If you look on page 70 in your ICD-10 book, you will see down the page, Section 4, Diagnostic Coding and Reporting Guidelines for Outpatient Services. All the information that I will be presenting on this chapter will be found in this section of the guidelines as well as the information in your textbook. So any notes that you make in your textbook, you may want to transfer over to your ICD-10 guidelines. Turn the page to page 50 in your step-by-step book. The I-10 guidelines state that your principal diagnosis for inpatient settings is called that principal diagnosis. In outpatient settings, you'll see it referred to as first listed diagnosis. These are the primary reasons for the encounter. The example that we use is a patient with an inguinal hernia presents with shortness of breath. The SOB, or shortness of breath, is what is first listed. In unconfirmed diagnosis, on page 52 in your step-by-step book, an unconfirmed diagnosis in an outpatient setting may take several encounters to confirm that diagnosis. The signs and symptoms are reported. So let's say, for example, the patient presents with complaint of frequent heartburn. A physician prescribed Prilosec for suspected GERD, with the patient returning in 10 days. We don't have a confirmed diagnosis yet, so we will report frequent heartburn. For outpatient surgery, page 53 in your step-by-step book, always code the reason for the surgery first, even if the surgery is not performed, followed by the code to report the reason the procedure was not carried out. So we always code for the reason of the surgery. If the surgery is not performed, we still code for the surgery, and then the reason why the procedure was not carried out. So let's say, for instance, the procedure was not carried out due to another contraindication. We would use Z53.09. Your Z codes, page 54 in your step-by-step book. Your Z codes, I want you to put a tab for your Z codes in your ICD-10 book. The Z codes you will find start on page 1027 in your ICD-10 book. This is actually a chapter that you will frequent, or a tabular that you will frequent. Put a tab, just Z codes. And we'll go over those in just a moment. So again, put a tab where your Z codes tabular starts 1027 in your ICD-10 book. The Z codes, these report circumstances other than disease or injury. The Z codes are informational. They may be first or additionally listed, depending on the circumstances. Your Z23 codes They report encounters for inoculations and vaccinations. This is where that procedure code identifies the administration. Your external cause index. For your external cause index, this is a separate index in your ICD-10 book. At the back of your book, page 1597, you should put a tab, External Injury Index or External Cause Index, however you want to remember it. But page 1597 in the back of your ICD-10 book is your External Cause Index. You want to tab that because that is another section you will be referring to. And you have to keep in mind when you are looking up your ICD-10 codes, if it is an external cause, you're going to this index first and not the alphabetic index. And they give you an example of what your external cause index looks like in figure 3.1. And you'll notice in your book as well, you'll be able to see what it looks like. Once you look up the main term in your external index, you would then go into the tabular to look up the code in the external causes and confirm in that tabular the correct code. Your external cause codes are never first listed, and they clarify the injury or the adverse effects. Observation stay. On page 63 in your ICD-10 book, observation stay, you will find the observation codes are Z03 and Z04. So if a patient is admitted for observation status, you would report the Z code as first listed diagnosis for the diagnosis stated as suspected or ruled out. Then, once the diagnosis is made, you would report the diagnosis as the first listed code. Coexisting conditions, page 64 in your step-by-step book. If there are coexisting conditions and they are present and they affect the patient care or it is treated, you would report it as a coexisting condition. So, for example, a patient presents with shortness of breath due to asthma. A physician prescribes a nebulizer treatment. The patient is morbidly obese, making an examination and treatment more complicated. So, your first listed diagnosis would be asthma. Your coexisting condition would be obesity. The examples in your step-by-step book are really good. Those are definitely things that I recommend that you read. Uncertain diagnosis, page 66 in your text-by-text step-by-step book. If it's an inpatient, the report is uncertain diagnosis as if it exists. So if you are an inpatient, you would report probable, suspected, questionable, rule out, and working diagnosis. If you have an outpatient, you would report the symptoms, signs, abnormal test results, or other reason for the encounter. For your chronic diseases, over on page 67 in your step-by-step book, your chronic conditions are treated on an ongoing basis. You report the condition as many times as the patient receives care or treatment for that condition. You would not report the conditions that were previously treated and no longer exist. So if you report a history code using Z80 through Z87, you would report the history code as a secondary diagnosis if that condition actually impacts the current condition or affects the treatment. Your diagnostic services over on page 68. If only the diagnostic service is provided, you would report first the reason for the service. So if a patient presents for a routine periodic gynecological exam, report Z01.419. And then you would, no signs, no symptoms, or associated diagnosis. Just that the patient presents for a routine periodic gynecological exam. Another example, patient presents for diagnostic imaging for left central breast mass. Report the N63, the unspecified breast lump, and then later on the diagnosis for the malignant neoplasm, you would report the C50.112. Your therapeutic services over on page 69 in your step-by-step. This is where a patient is receiving only therapeutic service, which is the report, which is the reason why they're there. So if someone's having chemotherapy, report the reason for the encounter, which in this case is the chemotherapy for breast cancer. Preoperative evaluation, page 70 in your step-by-step book. The first listed code is going to be the pre-op exam, which is your subcategory Z01.81 code. Again, Z01.81 code, it's a subcategory. It is an encounter for a pre-procedural exam. You have listed the codes for pre-procedural. You'll see that it's cardiovascular, respiratory, lab, and exam. Then you would code the additional reason, the additional code, which would be the reason for the surgery. Now, when we have pre- and post-operative diagnoses, on page 72, you'll see in the examples, you want to make sure you report the most definitive diagnosis, and that is usually going to be the post-operative diagnosis. On your reports, when you're doing your reports in the back of your workbook at the end of every chapter, your reports, usually you will pull from the post-operative diagnosis. If they are the same, you will be fine. But if you are doing your post-op reports, the post-operative diagnosis is usually what you will start coding. Your prenatal encounters or prenatal visits on page 72 in your step-by-step book. When you have routine outpatient prenatal encounters with no complications, report the category Z34. This is supervision of a routine pregnancy. For prenatal encounters where you have high-risk patients, report as the first listed supervision of high-risk pregnancy, which is 009. And that is it for Chapter 3. Now we're going to move on to Chapter 4. Chapter 4 is all about using ICD-10. Chapter 4, page 77 in your step-by-step book. The organization of the guidelines in ICD-10. If you look in your ICD-10 book, you'll notice that there's an introduction to ICD-10 right on page 1. I suggest that you read everything from the very beginning, the introduction, the terminology, the introduction, what is ICD-10, who is it developed by. It was developed by cooperating parties, the AHA, CMS, and NCHS. It is arranged in sections. And if you look on page 7 in your ICD-10 book, you'll see at the top of page 7, we have terminology, volume 1, volume 2, and volume 3. Volume 1 is the detailed tabular list of diagnosis codes. Volume 2 is the alphabetic index. And volume 3 are the list of codes for inpatient settings. You'll also notice that we have sections. Section 1 is the structure of the ICD-10, where we learn about conventions and general guidelines. So near the bottom of page 7, structure of ICD-10. Then section 2 and section 3. Section 2 and 3 are your inpatient principal diagnosis and additional diagnoses. Section 4 is the outpatient section, which we just went over in Chapter 3. If you turn to page 13, Section 1, Conventions, General Coding Guidelines, and Chapter-Specific Guidelines starts. So how do we use our ICD-10 book? We start with the alphabetic index, and when we look up the main term in the alphabetic index, we go into the tabular list to confirm it. So steps to accurate coding. First, we identify the main term in the diagnostic statement. Then we locate the main term in the alphabetic index referred to in the material as the index. We review any subterms under that main term in the index. We then follow any cross-reference instructions, such as C. We verify the code selected from the index in the tabular list, which is referred to in this material as the tabular. We refer to any instructional notations in the tabular, and then we always code to the highest level of specificity. You code the diagnosis until all of the elements are completely coded. So let's use this example. The diagnosis is Hodgkin disease. See lymphoma, Hodgkin. So if we turn to lymphoma, which is our main term, so find the alphabetic index in your book. The alphabetic index starts on page 1059 in your ICD-10 book. This is where your alphabetic index starts, and you'll notice it says Volume 2, ABC, in a red half circle up at the top right-hand corner. So if we turn to lymphoma, you'll notice that lymphoma starts on page 1318. And if you look, lymphoma is the main term. And then if you continue down and you find Hodgkin, which is the subterm, you will notice it directs you to the code C as in Charlie 81.9. All right, so we've just looked up lymphoma Hodgkin in our alphabetic index. Now we're going to put our hand here or a pen or something to hold our place so that we don't lose our place. And we're going to go over into the tabular under the C's, and we're going to find C81.9. C81.9 is on page 184, right-hand column, down near the bottom, C81.9. So what I want to direct your attention to here is this C81.9 is a subcategory. C81 is the category code. So if we turn back to page 183 in our ICD-10 book, you will notice C81, right-hand column, about middle of the page, middle of the column. C81 falls underneath the category of malignant neoplasms of lymphoid, hematopoietic, and related tissue. C81 is in a red-black box, and if you look at the legend at the bottom of the page, C81 in red tells us that we need to add 4th through 7th digits. And C81 is Hodgkin lymphoma. Then we have a definition of it, and then we have an excludes. But you'll notice that there's an excludes too at the top of the page. This tells us that excludes too might include Kaposi sarcoma, secondary and unspecified neoplasm of the lymph nodes, secondary neoplasm of the bone marrow, and secondary neoplasm of the spine. If any of those are involved, then we would go to those codes and use those codes instead of C81. As we go down to C81 and we read the codes, you'll notice that we start out with C81.00 as an unspecified site. Then as you read down through 01, 02, 03, you'll notice that each one has a different region or site: head, face, neck, intrathoracic, intra-abdominal, axilla and upper limb, inguinal region and lower limb, intrapelvic lymph nodes, spleen. So every additional digit to the code gives us a different site to choose from. Hodgkin lymphoma, or Hodgkin disease, in this example that we're using, took us to C81.9 on page 184, right-hand column, bottom of the column. Hodgkin lymphoma, unspecified. So C81.9 is the subcategory code. C81 is the category. Now we want unspecified, and we go down to C81.90. Hodgkin lymphoma, unspecified, unspecified site. In this example, this is the most appropriate code to use, because if you look on to the rest of them, you will notice that it is unspecified, but it indicates an area on the body. So far, so good? As you are looking up your codes in your alphabetic index and going over to the tabula to confirm the code, please make sure you always come back to or start at the category code and work your way through. You should be reading the before, the middle, and the end. And as we continue on throughout the course, we'll talk more about it. Level of specificity. Page 79 in your step-by-step book. Level of specificity. You always want to report the highest character available. You cannot report the 5th character if the 6th character is available. And if there is a 7th character, you should definitely report the 7th character if it's available. You'll notice on page 7 and page 8 in your ICD-10 book, it goes over the structure of the ICD-10 code. This would be a helpful place or helpful page for you to refer back to as you're doing your studies. So you can see the placing of the letters and how they refer to the codes. So your first 3 digits refer to the category. The number or letter in the 4th, 5th, and 6th digit correspond to the etiology, the anatomic site, and the severity. Your 7th digit is usually added for obstetrics, injuries, and external causes of injury. So your ICD-10 codes are going from 3 to 7 digits that are alphanumeric codes. So keep that in mind. You will not always have just a 3-digit code. There's always going to be a higher level of specificity required. And usually the highest level of specificity will be all 7 characters. So let's say, for instance, M48.48XA. The A indicates an initial encounter. So there was some type of trauma or injury that happened. There's no 6th character. You have X as a placeholder. And that's all it is a placeholder, so that we can add that A on for some type of an injury. Integral conditions. Integral conditions, page 81 in your step-by-step book. Again, you want to read all of the guidelines and introductions at the beginning of your ICD-10 book. Integral conditions. This is where the diagnosis is stated. Do not report signs and symptoms separately. So if someone has fever and shortness of breath due to pneumonia, you would report only the pneumonia. If there is fever and shortness of breath, the symptoms are of pneumonia. So again, integral conditions. Do not report the signs and symptoms separately. Report only the pneumonia. Not an integral condition. Page 82. You have 2 examples, not an integral part of a disease process. This is where the sign or symptom is not part of the disease condition, so you would report it separately. So if you have pneumonia and dehydration, the pneumonia is coded first, and then the dehydration. Not all patients with pneumonia have dehydration, but the dehydration was not stated to be due to pneumonia. If it was specified due to pneumonia, then it would be considered integral part. Etiology and manifestation. Let's say, for example, we have diabetic retinopathy. The diabetes is the cause, the etiology. The retinopathy is a manifestation, a symptom. So we have combination codes. Page 83 in your step-by-step book, and 84. So we have a combination code for this, and it is E10.319 for diabetic retinopathy. Another example, Staphylococcal aureus cellulitis of the face. This would be multiple coding. Multiple coding. Code first the cellulitis, and then the Staphylococcal aureus. So the cellulitis is L03.211. If we look up L03.211 in our tabular, L03.211, L03.211, cellulitis of the face, it tells us what it excludes. And then we code the infection. How would we know that? Because on page 436 in our tabular, at the bottom of the right-hand column, L03 in red, cellulitis and acute lymphangitis. Definition: cellulitis is an infection of the finger or toe, usually caused by normal skin bacteria that got wet under the top layer of skin. Signs of infection include red, warm, tender skin, swelling, fever, and or chills. We know we had cellulitis of the face, so we went over to L03.2. And then we look down into the column. L03.21 is a cellulitis and acute lymphangitis of the face. Well, that's not what our example said. It just said Staphylococcal aureus cellulitis of the face. So we go to L03.211 is simply cellulitis of the face. And then we would code the bacteria, the type of bacteria. Acute and chronic conditions, page 85 in your step-by-step book. Same condition, both acute and chronic, with a separate, same level of indentation in the index. Always report the acute first and then the chronic. But there will be some combination codes that are acute and chronic. Your combination codes, 87 in your step-by-step book. These report two diagnoses, usually a diagnosis with manifestation or a diagnosis with an associated complication. K80.00, acute cholecystitis with cholelithiasis. That is a combination code. Residual and cause, sequela or residual. Sequela also means late effect, so you might hear it referred to as late effect, sequela or residual. I will tell you that in your ICD-10 book, your sequela starts on page 1431 in the alphabetic index. That would be a good section to tab, as that is also often referred to. Always report the residual as the first listed diagnosis, then followed by the late effects code. Some combination codes will report one code, others will require two codes. The biggest thing in ICD-10 now is laterality. In ICD-9, we didn't have the laterality that we do in ICD-10. So you want to specify, is it right, left, or bilateral, or unilateral? but just pay attention to the codes. Those are the differences for Chapter 3 and 4. I hope that gets you started in how to use your ICD-10 book and how to use your guidelines and start tabbing. You will want to start tabbing your sections. I will post a picture on how to tab your ICD-10 book. And if you have any questions, please do not hesitate to email me. We can set up a video chat or phone conversation. Thank you for your time today. I hope that you have a wonderful day.